From VOA Learning English, this is the Health Report. Not many people consider a bacterium a friend, but scientist Roy Curtis does, at least the bacterium Salmonella. Mr. Curtis is a microbiologist at the Biodesign Institute at Arizona State University in Tempe. He studies Salmonella. It is the most common bacteria to contaminate or infect food. It is found in undercooked meats, eggs, and milk. Salmonella can cause severe nausea, vomiting, diarrhea, abdominal cramps, and fever. Millions of people are sickened each year by Salmonella. But a genetically modified version of the bacteria may someday be used as a weapon against cancer. Genetically modified means the genes in the bacteria have been changed in some way. Researchers in the U.S. and Germany say they have turned Salmonella into a weapon against cancer. Mr. Curtis says the Salmonella makes the cancer cells disappear. He and his colleagues modified the genetic material of the Salmonella to die in healthy tissue but kill cancer cells. They put human cancer cells into mice. Then, he says, they put the genetically modified Salmonella bacteria into the mice and sent them on a search and destroy mission of cancer cells. A medical journal titled mBio published an article describing the work. However, Roy Curtis says it will be a while before the genetically modified version of Salmonella is tested on humans. He wants to make more changes to the bacteria to increase their cancer-killing power. Salmonella would not be a standalone anti-cancer therapy. Instead, Mr. Curtis says he hopes it will be used in addition to traditional treatments. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Group cognitive therapy is a form of mental health treatment. A study has found that this form of talk therapy can help rape victims in countries where there are few trained psychologists. Researchers say the findings show that counselors in a community can be trained to provide group cognitive therapy. Judith Bass is a professor of mental health at the Johns Hopkins School of Public Health in Baltimore, Maryland. She says rape victims can face a series of short and long-term problems. These include depression, anxiety, and post-traumatic stress disorder. Sudden sounds or events can bring back memories of the attack. Professor Bass says sexual violence affects not just the victims, but also their communities. Warring groups use rape to dehumanize and humiliate their opponents. Judith Bass says women who are raped often suffer from social stigma in their communities. They experience fear and worry about whether they can meet the needs of their families. Cognitive behavioral group therapy has been shown to work in Western countries. Judith Bass and other researchers investigated whether it could help women in the Democratic Republic of Congo. The DRC has faced more than 30 years of conflict since 1960. After 6 months, 42% of those in individual counseling who were depressed at the start of the therapy no longer showed signs of depression. By comparison, 70% of those in the cognitive therapy groups were no longer depressed. In these groups, the women discussed goals and learned skills for overcoming their depression and symptoms of post-traumatic stress disorder. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. Green spaces are ones filled with plants, trees, and flowers. But these days, outdoor time competes for a child's attention with indoor activities like computers, television, and electronic games. Spanish and U.S. researchers studied whether a lack of outside activity in green spaces affects schoolwork. Dr. Payam Dadvan works at the Center for Research and Environmental Epidemiology in Barcelona, Spain. He and his team studied more than 2,600 children from 36 schools in the city. The kids were 7 to 10 years old. The researchers used information from satellites to learn how much green space surrounded each school. Over 1 year, the children took computerized tests 4 times to measure memory and attention span. The researchers then compared the amount of green space near each school with the test scores. They found that the children who were close to more green space had a better ability to memorize and were more attentive. The team says air quality is the main reason for the results. Trees help reduce air pollution. However, some experts question using satellite images to determine the amount of green space. Others say this study does not consider other factors in the schools. But the findings of that study seem to support a 6-year study on elementary schools in the U.S. state of Massachusetts. Researchers there studied students at 905 schools from 2006 to 2012. They found that children in schools with more green spaces scored higher on standardized tests. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. Imagine forgetting everything you have ever done in life. Jobs you held, a marriage you built, the children you raised, your friends, your travels, everything. For many older people, such severe memory loss is a reality. A man in Tennessee tries to help the old with the pain that can come with memory. Doug Oliver worked as a mental health care provider. He is retired now, but he volunteers at a daycare center for senior citizens in the southern U.S. city of Nashville, Tennessee. He goes there and talks with people about their past. Mr. Oliver uses a technique called guided conversations to help older people remember their past. Guided conversations are planned, purposeful talks. Mr. Oliver says it is important to get patients to connect memories of the past to the present and the future. These connections help a person reach memories that are buried deep away in the brain. To do this, the volunteer uses memories of good experiences and bad, successes and losses. Guided conversations start with memory recovery. But the aim of the talks is not just to remember. Guided conversations also help people regain a sense of self-worth. Mr. Oliver says the people realize through the process that they were and still are important. This helps fight depression in older people. Mr. Oliver says sometimes he thinks about quitting. He has an eye disease and cannot see well. For him, getting to the daycare center and home again can be difficult. But he says he always decides to continue his work. He says he knows he is where he needs to be, doing what he should be doing. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. A recent agreement between the American Heart Association and China could reduce deaths from heart attack and stroke in China. Cardiovascular disease, including stroke and heart attack, is the main cause of early death in China and many developing countries. Cardiovascular disease kills more than 17 million people around the world every year. Douglas Boyle works for the American Heart Association. He said the partnership with China can help people live longer and healthier lives. The agreement has three main parts. It calls for increasing opportunities for U.S. researchers, healthcare providers, and public health specialists to meet with those in China. The agreement also includes sharing cardiovascular research. And finally, it calls for training in China of life-saving techniques such as cardiopulmonary resuscitation, or CPR. CPR can restart a stopped heart. CPR has helped lower death rates from heart disease in the United States by 30%. Improvements in medical science and educational campaigns about preventing heart disease also played a part. The American Heart Association says teaching CPR to the people of China may help save lives. But will a bystander in China give CPR to a complete stranger? Several media reports have suggested that people in China may resist helping strangers in medical emergencies. This could be because the person helping can be held legally responsible for damage to the injured person. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. As we begin a new year, we thought you might like to revisit Learning English Health Report stories that were popular with you in 2014. They aired on our TV, radio, and website programs. Based on your comments, we know many of you like self-improvement stories. You like to read about staying healthy and living a long life. You like to know how your brain works best and what can affect your power of memory. Here are some highlights from the Health Report for 2014. We all sit a lot. The story Sit Less, Live Longer explored the dangers of sitting too much. It encouraged people to get up from their desks and move more at work. Many of you described in your comments how you move and exercise during the day. Some of you shared stories of losing weight and fighting illness to enjoy a more active lifestyle. Our listeners like their brains, and they seem to like reports on how to use their brains most effectively. For example, we wrote about a study that found if you write your class notes by hand, you will remember them better than if you type them. Our article, Women Giving Birth at Home on Purpose, talks about a U.S. birth trend. Increasingly, women of color are using midwives to give birth naturally. Two stories seemed to inspire many listeners. Jerry Reed earned his first college degree at the age of 70. And Mary Moe fulfilled her dream of becoming a pilot at the age of 91. We look forward to bringing you many more informative and inspiring health reports in 2015. For VOA Learning English, I'm Jonathan Evans.
Salmonella. Mr. Curtis is a microbiologist at the Biodesign Institute at Arizona State University in Tempe. He studies salmonella. It is the most common bacteria to contaminate or infect food. It is found that a version of the bacteria may someday be used as a weapon against cancer. Genetically modified means the genes in the bacteria have been changed in some way. Researchers in the U.S. and Germany say they have turned salmonella into a weapon against cancer. Mr. Curtis says the salmonella makes the cancer cells disappear. He and his colleagues modified the genetic material of the salmonella to die in healthy tissue but kill. From VOA Learning English, this is the Health Report. Not many people consider a bacterium a friend, but scientist Roy Curtis does. At least the bacteria found in undercooked meats, eggs, and milk. Salmonella can cause severe nausea, vomiting, diarrhea, abdominal cramps, and fever. Millions of people are sickened each year by salmonella. But a genetically modified version